Hello everyone, happy Friday. Welcome to this week's episode of Marlie's Corner. My name is David Gimmis, founder and CEO here at Paw.com. And of course, this is my trusty sidekick and our chief product tester, Marlie, coming to you live from the Paw.com offices in Marlie's favorite corner, Marlie's Corner, where we hang out, we talk everything paw, the people and the pets that make this go round. This week we have a super interesting guest. I'm really excited to talk to him. His name is Dr. Acl Christman. He is a veterinarian. He's an author, a social media personality, a fitness guru, really a jack of all trades. So we're super excited to get him on and have a chat with him. So without further ado, let's get us connected and this show on the road. And of course, as usual, we are giving away a $50 gift card, so please leave a comment or a question below, and we will be giving that out. All right.
Hi, everybody.
Hey, how are you? Thanks so much for chatting with us today.
My pleasure. Thanks for having me. This is so much fun.
Yeah, absolutely. So, Dr. Acl Christman, for those watching, maybe you could just tell everybody a little bit about yourself.
Yeah, sure. So, Dr. Acl Christman, I'm a veterinarian. I've been practicing for, my gosh, about 18 years now. I'm a huge doxaholic. If you haven't seen behind me, I have 4 of them. This is Clark W. Griswold right here. And behind me is Carl. We named him from Disney's Pixar's Up. And right here is Connor. And then right over here, our oldest, there's Chelsea.
Wow.
So, yeah. So, yeah, I'm a big doxaholic, big dog fan, of course. Love animals. Been in this business my entire life. I wrote a book, too, on dogs with disabilities called Honey Heavy Squeeze the Dachshund. So, and then I've been practicing and then transitioned over into working for continuing education for veterinarians, too. So dvm360.com is where I'm at. And then I have, doing my stuff with podcasts and helping pet parents. I do shelter medicine work. I'll be at the shelter tomorrow, actually. And then I teach the veterinary assistants. So a little bit of this, a little bit of that. I love it.
That's awesome. Yeah, it sounds like you're a busy guy. So how did you, Adam, how did you get into medicine, into, veterinarian medicine to be specific?
Yeah, I always knew, you probably hear this a lot, but in veterinary medicine, it's really a calling from here, from your heart, and then here, So I've always had a passion for science, and I've always loved animals when I was a kid. And I don't come from an animal or doctor background or whatever. We've had a few dogs growing up. I didn't live on a farm, but I just was always passionate about it. I was really obsessed with science and math. And I say this to kids because when I talk to kids in schools, I said, follow your dreams. Don't let anybody crush it, And so I went all the way through. I started working as a kennel assistant. And when I was young enough, I actually, even before that, fun fact, I actually had my own dog walking business when I was like 10.
Oh,
so
wow. I
just took little index cards. I put them in everybody's mailboxes. I had 10 dogs I would walk after school. And that was so much fun. And then, when I was old enough, I went and I was a veterinary assistant. And then I went to Rutgers University for undergrad. Your dog is so cute, by the way.
Thank you.
So what's his name?
This is Marlie.
Marlie is so cute.
Sorry about the noise out there.
Right.
We're beside a train track, and there seems to be a little commotion going on.
Sounds about right where you go live. It sounds about right.
Yeah.
But yeah, so that's what I did. And then I went to vet school at Iowa State University, and it wasn't easy. I'll tell you that. Like vet school may be easy for me. I had to study.
Yeah.
Because there's so many species, there's so much to
Absolutely.
study. It's what makes it tough.
Well, that's great. So Marlie, growing up, she had her fair share of vet visits. At one point, we were there like every couple of weeks, and it was interesting. When she was younger, she was fine with going to the vet, and as she got older, she's now more scared to the point where when we go, she's shaking, like
Oh.
uncontrollably shaking. So I was curious, is there any tips or any advice you have to other pet parents who are in that situation of how to calm their pet down and make the vet visit as enjoyable as possible?
Yeah, there's a couple things you could try. So one thing that's easy for everybody that's tuning in is find their favorite toy that they haven't had before, a brand new toy, and you're going to give that to them in the car. And it's going to kind of be a positive experience and a distraction for them. And my second tip is tell your veterinarian to give them another toy in the exam room. So like something that you know that your dog would go nuts for, but give it to the vet for them to give to the dog, and it makes the experience a little bit better. And then look into Adaptil. I don't know if you looked into that or not, but it's like a calming thing. It's a collar. You can use Peel Away for cats. You spray the carrier down a little bit too. Leave the cat carrier out the night before too. And a good carrier too is always important. So, you try to do it. And then the final thing that I recommend is exercise. Exercise. And tire them out before they go to the veterinarian a little bit to kind of take away some of the anxiety that they can have. And then, listen, it's come a long way in vet med. If they need a little something, like trazodone or gabapentin or something like that, it's not going to hurt to take the edge off of them before they go for their visit.
Yeah, all great tips. I'm going to try those out the next time. For her, it's definitely just a tennis ball. A simple brand new tennis ball out of a sleeve, and she's the happiest girl in the world.
I love it. That's like this guy here too.
So Adam, beyond medicine, I mean, you're a pet parent. You mentioned you have four Dachshunds. They all get along. They're one big happy tribe. How does that dynamic work?
They are. Look at them here. I'm going to turn the camera around so you can see. They
please. Let's
have
see
their
them.
own thing. Like this is them. I don't know if you can see, but this is them doing their thing.
They're just hanging out.
They're just hanging out. They have their own pack mentality. Yes, they have their gripes. they have their moments, but like they really do get along. And I say that because a lot of pet parents are interested in getting like another dog or another cat or whatever. And I say, do it. Because, you can desensitize them. They figure out their own stuff, like you got to do it over time. But the pack mentality is really strong in dogs too. It really is. So I just find it so interesting.
Yeah, I do too. And do you have a clear leader in that pack? The alpha?
Yeah, it's the girl. It's Chelsea.
Chelsea, I love that.
Yeah, she's the queen of all of them. I was like, you got to wrangle all your boys in, So.
And is there I'm curious, what specifically attracts you to that breed? I mean, clearly you love them. You have 4 of them. You have a book about them, which we'll get to later. But what is it about that breed that you love?
Yeah, when I was in vet school, I was on neurology rotation, and neurology is one of my personal favorites. I'm not a boarded neurologist by any means, but I really was very attracted to that field. Unfortunately, these guys, the long back dogs, the dolichocephalic breeds dogs, like these guys are prone to intervertebral disc disease. So one of my patients, Marlie, I'll never forget her, she was a dachshund, and I said to her, I think our paths are going to cross down the road when I start practicing. I really became in tune to like canine rehabilitation, and I like that a lot. Cut to when I was here, I'll actually show you Cosmo here. So here, if you can see, it's a little glare. There's Cosmo that you see right there. He was a patient of mine that came to me at the age of 2, and he was paralyzed. So he slipped a disc, and his pet owners were unable to afford for his care. So they signed him over to me, and I said, I'll take him. And he was only 2, and I said, you know what? We did the surgery, but I really do think that he could have a good chance on life, because the timing is of the essence with these guys. But unfortunately, he was permanently paralyzed. But fortunately, he lived another 12 years.
Oh, that's great.
We just put him down like a couple years ago. This is my other guy, Charlie, too. He passed away, too. My gosh. But this one is my inspiration, where I wrote a book, because his fortitude, his strength, to any pet parent that knows that a dog with one eye, a dog missing a leg, that can't hear, that's blind or deaf, has an incredible life. And Cosmo was no different. I was able to squeeze his bladder, because you have to like express his bladder because he's paralyzed. I had to do it for 12 years. I mean, my whole schedule rotated around him too. And so that's where I wrote the book, because it was one of those things where it's nice to give some pet parents peace of mind, knowing that it's going to be okay. It's going to be okay. Yes, he was in a cart. Yes, my whole life and vacation revolved around him, but he was well worth it. I'll show you. Let me show you like the pictures of him. Giving you the tour. Look, my whole house is for them. You know, like, so there's Cosmo, there's Chelsea, and there's Charles. But yeah, that's where he is, and they're just forever and dead in my heart. Look how obsessed I am. Wait, look.
Hey, at the end of the day, pets are family, right?
They are family.
That's it.
I love them so much. They're my world.
That's awesome. And yeah, I wanted to ask you about the book, but you went into it there, and I haven't read it yet. We're gonna get a copy for the office, but it must be a feel-good kind of story. And I love the fact that you said it gives pet parents hope, because you know sometimes these pets, these family members get into situations and they need that support, just like any other family member would. So I think it's fantastic you're doing that.
Thank you so much. They really do. And I think they teach us as veterinarians too, to, like, you know, continue to fight the fight. And the hope and spirit is so strong in them. It's incredible. And as a pet parent too, to a dog that was paralyzed for 12 years, he was no different, and I treated him no different than the other ones in the pack too, and he loved that feeling, you know. That's so awesome. Yeah, it's a great read. So
outside of being a veterinarian, a social media personality, an author, I've heard you're a big fitness freak. You're a big fitness enthusiast, and I know next month is Canine Fitness Month, so I was wondering if you're doing anything in April, and if you have any tips for the viewers on how to stay healthy, active with your dog. And it doesn't matter, any size breed, or, you know, a Dachshund or a French Bulldog or a bigger animal. Do you have any kind of tips that can help people to stay active, fit during Canine Fitness Month?
Yeah, so you know, obviously walking them. We're going to be hosting our Wiener Walk on the boardwalk here in Jersey. It's going to be a socially distant one, of course, but it'll be a fun one just for everyone to stretch their paws a little bit, because we've been in like quarantine for quite some time. But exercising them is good. I mean, if they don't give you purpose every day to get up and move, I don't know what does, right? Yeah. If it's a dog or a cat. And I really do it. I give talks to fellow veterinarians about the importance of just movement. So just move, because it keeps your head and mind right. It's really important up here. You know, this is a big thing in our profession. Mental health is huge all around, but a little bit more specific towards veterinary world too. And I'm really big about like talking about that and exercising. So, and listen, there's not many things that are reversible in veterinary medicine that you can actually reverse. Canine obesity and feline obesity, that's reversible, my friends. Yeah. You know, so like that's something that I'm really passionate about, because you can actually, you know, get that weight off them, keep them living, heart, kidney, all that stuff, making sure they're nice and healthy on their hips and joints. So yeah, exercise, go for a hike. They're swimming them when it gets warmer in certain areas of the country too. A lot of fun. I love it.
Awesome. Great tips. Yeah, and we're looking forward to April. I mean, it feels like every month here is Canine Fitness Month. Marlie, for example, she's off screen, but she comes to the office. She's running around after the ball all day, visiting everybody, all parts of the office. So she definitely gets her activity in.
Where do you live? Where do you live?
Beyond being an active veterinarian, so you're also a professor.
Yes.
Tell us how that happened. How did you get into now, you know, teaching veterinary medicine as well?
Yeah, I love teaching. I think, you know, everybody's a teacher at some capacity. And then I got asked to, so this is interesting. I first started teaching on the human side, veterinary nursing program, because they actually did not have an instructor that was competent enough to understand the anatomy of the cat. And I said, oh, I'm that guy. I know that. That I could do. So I started teaching the human nursing program, which was great. They loved it. The fact that I was able to help kind of show comparisons to things. So I was doing that for 5 years. And then there was a huge need in our area to have a veterinary assistant program. So we worked towards creating an accredited programs through the National Association of Veterinary Technicians and Assistants. So we have that. I've been doing that for about 8 years. And you know what I love about that is it's a continuing education program. this gives hope to those that maybe are not the best test takers, or maybe they need another career in their life. They just love animals, but they just don't know where to begin. And it's a 1-semester course. They get the job shadow multiple practices. I teach them on the weekends. So they get like the good content, and then they get the experience. And, you know, I'll never forget. So we've had, we're about to hit about 200 graduates over the course of these years, which is great. Yeah. And there's one student I'll never forget. His name is Nolan. And his parents came to me, young kid, and he has autism. And they said, Dr. Christman, there is something about him that he's just connected to animals. I mean, he's having a struggle in school and all that. I said, let's see what he can do. Cut to 5 years later, Nolan got promoted to a veterinary technician. He is doing amazing things. The animals and the pet parents love him. And those are the reasons why I continue to teach, just to give that, you know, inspiration to others, because there is a change. Anybody can do anything.
That's
so
fantastic.
Yeah.
What a good story. What a good story. I love that people are getting that opportunity. So really great that you're doing that. Jeff, do we have some questions for Adam?
Yes, we've got a ton of questions for Dr. Christman. So one, Pork Chop the Frenchie asks, any suggestions for preventing separation anxiety?
Yes. So thank you for your question, Pork Chop. And how are you being a good boy or a good girl? We got to get the head tilt. Got to get the squeaky. So yeah, so slowly but surely wins the race with separation anxiety. So it's a big conglomerate to chat about, but there's a couple of things that you can do is like go to the mailbox, go for a little walk, leave them for a couple minutes, let them know that things are gonna be okay. I put this on my TikTok video. If you make a big fuss out of you leaving, they're gonna make a bigger fuss when you're gone. So don't want to be like, Mommy loves you so much, I swear I'll be right back, I love you, I love you, I love you, I love you. Because what's that doing? That's resonating, like, oh my God, what's happening, what's happening? And then, where did she go? Where did she go? You know?
Oh,
like,
man,
oh my God, where
I'm
did Mommy
guilty
go? Where
of
did Daddy
that.
go?
I am guilty of that, I have to say.
Don't do it. Just, you know what? Get up and leave. That's it. And they'll be like, oh, all right, he'll be back. It really does.
How is Marlie going to know that I love her so much if I don't tell her on my way out?
She knows. She knows.
Bella B. the Iggy asks, should dogs wear sunscreen? And if so, what kind?
Yeah, there is a particular sunscreen that they can have like an SPF 15 or 13. Check with your veterinarian about which one they would recommend. If they're the ones that have like the albino skin or the white color coats, you could be careful or could use it. And then also check your nose and the toes on them too, because some of their noses can get a little bit burned on there too. But I generally don't recommend it overall. Like, I just feel like you need to use your due diligence to just be mindful of it. But it is a good question to check with your veterinarian about that.
Yep.
Cool. And just for me, I want to say I'm so happy you explained when I saw the title of your book, Honey, I Have You Squeezed the Dachshund. I was trying to wonder what it was about, and so you explained that had to do with squeezing the bladder, right? So
that's exactly right. That's exactly right. Yeah.
Great.
There's a story behind it.
Yeah. Gia_Doxie asks, what precautions do you take to help prevent IBDD in your Doxies?
Gia, I'm going to show you. Are you all ready for this?
Let's see it.
Okay. I have ramps. You better get ready. I don't think your viewers are ready for this. Okay. Let me see if I can do this right. So I have a ramp. What I'm about to show you is you're going to see 4 dachshunds go down a ramp right now. And so we have stairs to the backyard. And so what I did is we had our carpenter built right into it a ramp. So the reason why is because that going up the stairs like that can really put compression on their disc material, known as the annulus fibrosus. So it can really compress that. So what you try to do is picking them up, making sure that, you know, they don't like to jump. Now, listen, they all love to do it, but you have to minimize as best as you can. So ramps are a big thing to have. So have them near your bed, have them elevated food dishes, and then ramps outside. So you ready for this? Okay, let me take a turn this around. I'm gonna turn the camera around. Guys, we're gonna go outside. Okay, so right here is where the ramp is, okay? So watch this. Okay, here they are.
Oh, they're ready to go.
Yeah.
Hey, look at that. Get on the ramp. That's kind of like a slide.
Yeah. So wait, I have to go back into the Wi-Fi. But yeah, can you see it?
That's awesome.
Yes. So that's what I figured. So that's this is a great ramp. So ramps are fantastic for those kinds of things. And it doesn't have to be super fancy, like at least something, because you train them. So I get asked, like, how do you know to do that? Treats, my friends. So get lots of treats to train them to go up and down that ramp. And lo and behold, they'll know. If they happen to go here, I just use a verbal like that, and they know not to go up there. So wait, look at
great.
them.
Yeah, and I also hear French Bulldogs can have that same issue. So I'm trying to be mindful of the jumping and
Steps.
and the steps and the bouncing around. But
Yes,
it's difficult, right?
Yeah.
so I'm glad you mentioned that too, because French Bulldogs are on the list for that too, for irreversible disc disease. It's actually, they're right underneath Doxies. So, and cervical. So cervical. So a good suggestion is a harness for them too, versus a collar if you're going to walk them. A harness, so that way you're not pulling too much on the neck muscles that can cause like irreversible disc disease. So,
Well, good to know.
Those are good tips.
Thank you.
Got a few more questions if we have time.
Yeah, let's set up a few more.
A Cavett boy said, I had a cat which was hit by a motorcycle on the roadside. She's not eating since then. Please tell me, what shall I do? I am a vet med student.
oh my goodness. Well, congratulations. I'm about to be entering the best profession on the planet. But I definitely would want to make sure you get that evaluated, because, if you may or may not know, but cats, if they go off their food too long, they could develop fatty liver syndrome or hepatic lipidosis. So especially if they're not eating, maybe if something's going on, they're in pain. So get him or her checked and evaluated, because we don't want that to go on. There's medication like mirtazapine and cyproheptadine, things like that you can increase their appetite. But you want to address the underlying cause. There's a reason why they're not eating. So. Yeah.
Yeah. Stop watching right now and head to the
Right.
vet.
Absolutely. Absolutely.
Yeah.
Sparkle Notco asks, what's your recommendations for an ACL recovery? My 10-year-old dog had it last year and is still struggling with getting back to her normal self. Any suggestions would be much appreciated.
Yes. So thank you for that question on ACL. So a multimodal approach to rehabilitation. So laser therapy, acupuncture, hydrotherapy, and doing some physical exercises yourself. Simple things like putting their back leg on a seat cushion and moving them back and forth so they can work their core muscles, just like this, back and forth, back and forth. Passive range of motion exercises with the knee, flexing and extending, flexion and extension, and then rotating the hip too. I want you to keep those muscles going, because if they're not moving those muscles, then they certainly can atrophy, and it can just increase the delay to the healing process. Definitely look into laser therapy too. I think laser therapy has great value to that knee as well as the hip. And then I'm a big advocate for acupuncture. Now, if you can't do or find like a board certified physical rehabilitation specialist where they have the underwater treadmill therapy, where they just have a little buoyancy, it helps with your hip. You can do things at home too, just short leash walks and exercise, non-invasive exercises as well. Now be careful, because the other leg has a good chance too of blowing out the cranial cruciate ligament as well. So you want to be careful, because the way in which they're distributing their forces on those knees can also affect the other one. But slow and steady, again, wins the race with that. Or you can do what I do. When my dogs were paralyzed, I said, time to get a pool. And so we had to get a pool put in for Cosmo. So that way, we could do rehabilitation with them, because that's what you do as a dog dad.
Yeah, you just dig a hole in the ground, fill it with water,
right.
And there you go.
Exactly. And then right now they use it for sunbathing on here.
That's funny. Well, very, very informative. Lots of helpful tips and ideas. Dr. Acl Christman, thank you so much for taking the time to chat with us today. We really appreciate it.
Yeah, we have a lot of questions. We'll have to do it again sometime and get to some more questions.
Yeah.
My pleasure. Wait, we got to give a shout out to Dr. Ross Henderson, my friend. I love him so much. He's so funny, too. What's it going to be? What's it going to be, Dr. Ross?
So anyone watching, make sure to check out Dr. Acl Christman's social media. You want to drop your TikTok, your Instagram, all the fun stuff?
Yeah, sure. So, Adam_Christman is my Instagram handle. I had to double check. I'm like, is it Adam? Yeah. And then my TikTok, I'm actually going to write it in the chat for you. It's Dr. Acl Christman 52. Look at me multitasking like that. Who is that? It's like the veterinarian in me. I have my own website, dradamchrisman.com, a YouTube channel, The Dr. Christman Show, and a Facebook page called The Adam Christman Show.
And the name of the book. Remind everyone the name of your book again.
Honey, have you squeezed the Doxin?
Yeah, we love it. Well, thank you again. We appreciate you and all you do for the pet community. Have yourselves a good rest of the day and a perfect weekend. And hopefully we'll get a chance to chat soon.
You got it. Thank you for having me on. My pleasure. Bye, everybody.
All right. See you later, guys.
Bye.
Thank you.